Hi, Assalamualaikum. My name is Zaida and I'm your audiologist in Eartistic Shah Alam. So today I'm going to share with you 10 frequently asked questions about vertigo since it's balance awareness month in this September. So I'm going to share with you 10 frequently asked questions about vertigo. So if you're ready, let's join with me, and if you have any questions, please drop in the comment below. Alright, so let's start sharing my screen on. Oopsie. Alright, okay, I think I can see it. Okay, I hope you can see it very well. And frequently asked question. I hope my voice is very clear. Let me see. Okay, so the first frequently asked question is, what is vertigo actually? Vertigo is a type of dizziness that causes a spinning sensation. Means that you feel a spinning sensation when you are in a still or static position. Okay, a person may feel as if the room or environment around them is moving even when they themselves are still. Vertigo can accompanied by lightheadedness and it can lead to nausea or vomiting. Right? So the next question, I'm not sure if my slide is moving. I think my slide is not moving. So hang on. Okay, probably my slide is slightly late. Okay, it's okay. I think you can see it's what causes vertigo, is it? Alright, so what causes vertigo is basically, let me make it big. Alright, I hope so. Alright, so I try to present it in the slideshow, but somehow it's not presenting. So let's show. Alright, sorry. I hope you can see it, but I try my best to make it bigger. But that is the best I can give in this live, and it's okay. But the content is important for you to listen to. Alright, so back to question number 2 that frequently people ask about vertigo is, what causes vertigo? So balance and hearing disorder, trauma, migraine, cold virus, or ear infection are all common causes of vertigo. Other causes may include medication or blood pressure problems. What all these conditions have in common is that they affect the inner ear, which help us balance. Alright. When there is a dysfunction in the inner ear, this can affect the sense of balance, leading to the symptom of vertigo, dizziness, nausea, vomiting, and loss of balance. Alright. Okay. Hang in there. Somehow my internet is a bit slow. I hope you be patient with me. Or maybe I just start sharing this and just alright. Back to me. Let me just talk and share with you what is the content of 10 frequently asked questions about vertigo, right? The first one is now is about the what is the vertigo itself. It's a spinning position, alright, where you can feel the environment is spinning. And then the second frequently asked question is, what causes vertigo? Okay, vertigo can be caused by a lot of things like feeling a balance disorder, migraine, trauma, or a simple cold infection or cold virus or ear infection. Alright, so because all of this, it might affect our inner ear. So inner ear is helping us to keep balance. Alright, so when there's infection to our inner ear, we might feel a little bit of vertigo or spinning sensation. Alright, the next frequently asked question is BPPV. Probably people that doesn't ask about BPPV, but they might describe the symptom looks like BPPV, or in the long name is what we call it benign correctional positional vertigo, right? So BPPV is a positional vertigo. Alright, in this condition, patient complain of spinning on getting up from bed or turning their head to certain position. Right, so like turning left and right might cause them to feel some spinning sensation. Alright, so it's positional related because our balance system is located in our right, in our ears specifically. Okay, so BPPV is caused by a displaced calcium carbonate crystal with within the inner ear. Okay, so it can be treated by identifying the position of the crystal in the ear and reposition it with a specific exercise. All right, so hopefully that should give you a bit of idea about what is the position of vertigo. All right, the next question, I think question number 1, 2, 3, 4. Okay, question number 4 is, in what age is vertigo is commonly found in people? Okay, based on my experience in Eartistic, I met few range of age. So basically, vertigo can affect people in all age actually, from young children, middle age to elderly. Okay, most of my cases I think it's about middle age, and I've seen also young children, age 7 or 10 years old, if I'm not mistaken. Alright. So, however, the underlying cause of vertigo may be different in different age groups. Okay. So, younger children, middle age, and elderly will give a different underlying cause. Alright. Next question. I think question number 5. Does vertigo runs in family? Okay. Quite common people ask this question because somehow they know vertigo terms based on their circle, right? So sometimes they see ENT doctor, then the ENT doctor will say about vertigo, right? Okay, certain causes of vertigo can run in family like vestibular migraine. Okay, a family history of vertigo, headache, and tearing mouth should be looked for in patients complaining of vertigo, right? So what is vertigo? Vestibular migraine is the next question. Okay, so vestibular migraine can cause a combination of vestibular effects, visual auras, or sensitivity to visual stimulation and motion at different times, and they can occur with or without an actual headache. Okay, so usually vestibular migraine is related to, you can have headache or didn't have any headache. Alright, so I always say if you have a history of migraine, you might have a vestibular migraine. Alright, so the next question, people have to ask, how does vestibular rehabilitation help you? Right, so when we have okay, I think that's the one of the questions. When we have rehabilitation effect, what we do, right? So towards the end of the treatment of this video is that we provide a vestibular rehabilitation exercise. Okay, so how does vestibular rehabilitation exercise help in vertigo? Right, so vestibular rehabilitation is very important to help relieve the recovery memory. It works on principle of helping the brain develop alternate strategies to improve balance function. Alright, so vestibular rehabilitation is actually helping the brain to develop alternate strategies. Alright, so vestibular rehabilitation exercise need to be tailored to work on the weak side. Identifies through the vestibular test. Okay, so basically vestibular rehabilitation exercise is very customized. Okay, so you need to do the assessment before you can do the vestibular rehabilitation exercise. They need to be progressively challenging to help the patient recover balance over several weeks. Okay, right. Next question. What are the tests to determine the underlying cause of vertigo? Probably this question should be asked first, okay, before vestibular rehabilitation, but it's okay. It's among 10 frequently asked questions. Alright, so the question is that what are the tests to determine the underlying cause of vertigo? Alright, usually there's a lot of tests to determine a cause of vertigo. Okay, so after a detailed history of vertigo patients should undergo a thorough vestibular evaluation. This will include tests like video nystagmography, video head impulse test, and dynamic visual acuity test. Some patients may require MRI of the brain or genetic tests. Also, it's important to measure the hearing function to check because hearing and vestibular system sit next to each other, right? So when one system is down, we need to check the other room, all right? Okay, so why is it critical to treat vertigo? Okay, if you feel vertigo or you experience some spinning sensation, it might affect your daily routine. Okay, so it's critical to treat your vertigo. Don't take it lightly. Alright? So any deficit, imbalance system resulting in vertigo, unsteadiness or imbalance will affect the day-to-day activities of the patient and diminish the quality of life. Alright? It may cause a drop in confidence of the patient as well as induce a fear of falling or movement. Okay, because remember, vertigo doesn't cause death, but fall can cause death. Alright? Treating vertigo will help restore the balance and confidence of the patient. The fear movement may cause the patient to restrict themselves and sedentary lifestyle and lead to depression and anxiety. So we don't want to lead our life into that bad lifestyle, okay? So we don't want the depression and anxiety. But if you do have depression and anxiety, do seek help from professional. Alright? Whom should I get consult for vertigo treatment? Alright. Vertigo usually caused by inner ear disorder. Alright, so I think you quite understand about ear system. From the outer ear, we have two parts, inner part and the other part. So vertigo basically caused by inner ear disorder. Yes. So depending on the reason that causes vertigo, and treat vertigo with neurology, or pulmonology, allergies, and even allergies are coming. And psychotherapists can be right. So there's a lot of professionals that we need to see to help you to get your balance. Alright? I think that's all. When everybody asks questions, I would like to share with you guys this relative balance awareness month. I think until 25th September, right? So if you have any inquiry or any problem related to vertigo or vestibular or balance or tinnitus or hearing problem, feel free to contact me in the numbers below 011 3764 3775. Okay, so that's all sharing from me. Zahidah Zainal, your audiologist in Eartistic. See you later.